the public. Iran has more than 2,500 confirmed cases. After initially playing down the extent of the virus, Iranian authorities now say they're mobilizing the military to tackle it. At 77, Iran has the highest death toll outside China. Worldwide, the total number of infections is now over 91,000. In more than 31,000 patients have died, with the majority of 3,000 patients have died, with the majority of those in China. But the number of patients who have recovered so far from the virus worldwide is over 48,000. South Korea, meanwhile, has recorded its biggest single-day jump with 851 new cases. More than 5,000 people are infected there now, prompting the president to declare his country is at war with the coronavirus.
Their president says the country is at war. They've passed their training and they're ready to be sent to the front lines. The South Korean President Moon Jae-in.
The coronavirus continues to spread at speed. This time last week we were talking about cases in under 40 countries. Now that figure is 67. There are also close to 90,000 cases worldwide, and the global death toll has gone past 3,000. Crucially, the vast majority of new cases are outside China. Here's the latest from the World Health Organization.
We are in uncharted territory. We have never seen before a respiratory pathogen that's capable of community transmission, but at the same time, which can also be contained with the right measures.
Well, the European Union has set up a special task force to try and manage this crisis. We heard from the President of the European Commission earlier.
The risk level has risen from moderate to high for people in the European Union. In other words, the virus continues to spread.
So that risk level is the second highest available at the EU, and we know that Italy is by far the worst affected country in Europe. It has over close to 1,700 cases, and the death toll has gone past 50. Next on the list would be Germany with 150 cases, and as you can see in this clip, caution abounds in Germany and elsewhere. Here we have Angela Merkel going to shake the hands of her Interior Minister. Thanks but no thanks was the response, and health experts have been emphasising that good hand hygiene is essential to containing this virus, and that point was picked up by Boris Johnson today.
The single most useful thing that we can all do to support our NHS to stop the spread of coronavirus is to wash our hands. 2 times happy birthday, hot water and soap.
Boris Johnson talking about happy birthday. That's because the World Health Organization recommends singing that song twice while you wash your hands. That means you've done it for long enough. Well, if the WHO is trying to stop this escalating worldwide, in China, well, really the crisis has already escalated, and we've learned a lot from what's happened in China. This chart shows us the fatality rate and how it increases exponentially by age. See how the vast majority of deaths have been in people of 70 or older. We also know that 90% of all the deaths worldwide have been in Hubei province in China, which is where the outbreak began. For example, just today, China confirmed another 42 deaths there. Here's Robin Brandt in Hong Kong on that.
What's most significant about those is that all those deaths occurred in the province of Hubei. That is the place where this all began. There are no new deaths across the rest of mainland China.
All of the deaths so far involve elderly patients or patients with underlying health issues, most linked to a Seattle area senior center. While in New York, experts warn the virus will spread there after a healthcare worker contracted the virus, likely during a trip to Iran. She's now quarantined at home and does not need hospital care. In Miami, the school district is already preparing 250,000 laptops and tablets for students to work from home in case schools are closed.
This is not the time for parents or teachers or students to be concerned with perfect attendance. If you're sick, don't come to school.
President Trump on Monday met with drug company CEOs.
When do you think you could have the vaccine?
Pushing them to quickly develop a vaccine while seeming to contradict a timeline offered by Dr. Anthony Fauci, the nation's top virus control expert.
Do you accept that this will take longer probably than you would like?
I don't know what the time will be. I don't think they know what the time will be. I've heard very quick numbers, a matter of months, and I've heard pretty much a year would be an outside number. He's asking the question, when is it going to be deployable? And that is going to be at the earliest a year to a year and a half, no matter how fast you go.
Meanwhile, in Denver, no coronavirus cases yet at National Jewish Health. But over the weekend, someone came into the hospital and stole protective masks meant for doctors, nurses, and patients. With supplies running low nationwide, the hospital is now...
Intellectually, we shouldn't panic, but guys, when I went to see Tara in the green room, do you have your stethoscope in your purse? Could you feel my forehead? Am I feeling chills? You know, your mind just goes all sorts of places. I haven't been to China, I haven't been to Italy, been in contact with anybody. We keep hearing that the elderly are susceptible. Who else is susceptible to this?
So we're all susceptible because this is a new virus. But the question is, in who does this become serious? And exactly what you said, the elderly
are more susceptible.
More susceptible to this virus becoming a serious pneumonia and having further complications. So in China, the data that we're analyzing, they found that 15% of those over 80 died. So we're really talking about those over 60, 70, 80 that are really at risk.
Kids are okay?
So what's interesting is that children, for some reason, seem to be less susceptible to this virus, whether it's because they're not getting the infection or because they're not mounting as severe a reaction to it. In addition, those with chronic medical conditions, so those who have chronic lung disease, hypertension, cardiovascular disease, diabetes, obesity, this is the population of people that needs to be a little bit more concerned.
Given what we're seeing here in the U.S., how likely is a spike in serious cases here?
We're definitely going to see more cases. So people shouldn't get alarmed every day when we come on the air and say, we have another case, we have another case. Yeah. We have not been testing in this country as they have in other parts of the world. For months, they've been doing thousands and thousands of tests internationally. We've done about 500. For the
whole country.
Right. We've just sent out 4,000 test kits last week, 75,000 this week, 1 million by this weekend. So there's no doubt we are seeing the tip